Hello everyone, and welcome to our discussion on the use of AI in healthcare. My name is Scott Power and I'm the Healthcare Analyst for Morgans Financial, and I'll be your host today. Joining me for the discussion, I'm pleased to welcome Simon Kos, who's the Chief Medical Officer for Microsoft Australia New Zealand. Simon is an internationally recognised leader in the digital health world, working in senior roles for over 20 years. He's a registered medical practitioner, has an MBA, and is a fellow of the Australian Institute of Digital Health. Also joining us is Teri Thomas, who's the CEO of Volpara Health. Teri joined as the CEO for Volpara just over 12 months ago. Prior to joining Volpara, she spent over 20 years with Epic, a global health systems provider, instrumental in growing the business from 10,000 people to over from 100 people to over 10,000 employees. She's also a registered nurse and has a Master of Science. Sitting next to Teri, we have Lester Litchfield, who is the head data scientist for Volpara. He works with a team of imaging scientists, engineers and analysts to unlock insights and solve clinical problems. His recent work includes helping to quantify calcium in breast arteries and novel methods for explainable AI. And finally, from Alcidion, we have Nick White, who's the Director of Analytics and Insights. Nick joins Alcidion with more than 20 years of experience across startups, top-tier consulting firms, spanning across the healthcare and communications industry. He has experience with health analytics, conversational AI, business process automation and machine learning. So let's get our discussion started. The cost of healthcare is exploding in many countries, driven by the ageing population, medical innovation allowing more complex procedures to be performed, new drugs are treating diseases better, which is keeping us alive for longer. So what part is AI playing in that? The latest thing in AI that I've come across is this chat GPT. How does that play a role in healthcare? But the first question to Nick is just to explain a little bit about Alcidion and its role, how it sees AI in that business.
Thanks very much. So Alcidion is an Australian-based healthcare company. We're focused on providing technology solutions to healthcare providers, primarily in helping them manage their clinical information, patient information and clinical workflows, and also in informing better decision-making. Software includes things like patient flow, helping patients and understanding how patients flow through the hospital systems, patient administration systems. We have a modular EMR solution, an electronic medical record solution, and also real-time data management and advanced analytics. And all of this is Fire-based and cloud-first and fully integrated. In terms of AI, we're very much on the operational side of AI. So we think about how do we help clinicians to execute their work. And so the kinds of places where we built AI into our solution are around decision support. We have decision support built into the platform. We have predictive capabilities around bed block, which is when we run out of capacity within the hospital, either in ED or in admitted patients. And we also have our own proprietary clinical NLP that we've built, natural language processing capability, which is built into things like search. And when you're typing your notes and picking up the kinds of clinical information that you're writing and how that might be searched upon in the future. So they're the kinds of areas where we've built AI into our platforms.
Teri, if I could ask you the same question, just Volpara's role in AI and how they're using it?
Sure, absolutely. By the way, thank you for coming. And because AI is based on the data that we put in and the belief that we have at Volpara in precision, I need to actually make sure folks know I've not been CEO for a year quite yet. So I've been with Volpara in this role since April of last year. So anyhow, what Volpara does, our purpose is saving families from cancer. And related specifically to AI, there are three ways that we use AI. One of those is for objectively measuring the density of breast tissue. So we use physics to characterize the amount of tissue that is fatty tissue versus fibroglandular or non-fatty tissue and come up with a very precise and objective measure of that breast composition, which is tightly related to someone's risk of developing breast cancer or masking the fact that they may have breast cancer that you can't see on a mammogram. So that's one of ours, the first AI application for our company. We also apply AI to analyzing the quality of a mammogram. So when we look at the output from a mammogram, it relies on a technologist to appropriately position a woman in with the machinery to get the right views with the right compression. It also requires the machinery to work correctly, so the right dosage, for example. All of the pieces need to line up to get an image that is of the appropriate quality that somebody can assess. Does that person have breast cancer or not? Is it clean or not? So that's another application of AI for us. And the third application of AI, which is one of my favorites, is new insights. So as Scott mentioned, Lester here, who knows more about AI than I do, so you'll see me going, what do you think, Lester? Lester's team, our science group, they use AI to find new insights, discover new algorithms. So we've worked with Microsoft's help on breast arterial calcification, identification, and quantification. And I don't know if there are any other Asians I can say related to that. But we are working on discovering new insights and things that can make our purpose of saving families from cancer easier and to help our customers provide insights into the health of their patients.
Simon, if I could move to you and just ask that question, why do we need AI in healthcare? What are you seeing from Microsoft's perspective?
So I think you pointed out the great challenges that health face. And if we continue doing and delivering healthcare services in the same way, with the demand that's overwhelming and the costs that are escalating, we won't be able to be economically sustainable here in developed worlds or equitably across the globe. So I think it's really important that we look at the role that technology can play. How does Microsoft view AI? We're in the business of cloud, and so commercially it makes sense that when AI is adopted, it generates storage and compute, so that's commercially good for us. But more from a noble social purpose, we think that AI has enormous potential for the betterment of society, and so our view is, if we can create the platforms that democratise access to artificial intelligence, allow others to do great things with this powerful technology, that's the job that we want to perform. And that's why we work closely with Alcidion and Volpara so that they can bring their expertise in their specific industries to life using tooling that is scalable, modular, secure, and interoperable.
I mentioned ChatGPT. Nick, I wonder if I can go back to you, just in terms of some of the applications that you're seeing across, your industry and your experience that you've had with AI.
Yeah, thanks, Scott. We were talking about the important and exciting things we're seeing in AI. I'm doing a bit of research at the moment on a paper that I'm writing in AI, and I thought, let's have a little bit of fun. So I put it to ChatGPT and I said, will AI ever replace the role of a clinician in clinical decision making? And I was quite surprised by the response. ChatGPT came back and said no. The output was that it felt that understanding the context of the patient's situation would be something that AI would struggle with, and so that there would always be a role for the clinician in terms of that diagnosis. And it's an interesting viewpoint, and it leads to sort of lots of different thoughts off that. But one of the main things for me was the importance of that data and context and understanding in terms of taking what's coming out of a diagnosis and then thinking about how you're going to apply that in a care journey. So for me, I see it as slightly nuanced. I think AI will play an increasingly strong role in the clinical diagnosis and output, but there'll be a role for the clinician in terms of what's the care journey, what's the response to that. And so that for me is just really exciting to see in terms of the technology and how it's evaluating itself. In terms of me and what I think is really important, exciting, I'm watching the world of drug discovery in pharmaceuticals and the use of ML in drug discovery, and that for me is just such an exciting space where we're seeing AI applied and the kind of responses that we're going to have in the future. And what you were talking about just then, Teri, is an example of that. But in terms of the operational sense, I'm excited about applying this AI technology to the lives of care workers every day. I come from a family of care workers, and my mother-in-law was a nursing unit manager, and just thinking about how AI can support the decisions that our clinicians have to make every day, for me, is what really excites me, and the kind of technologies we're going to apply.
Lester, if I could move to you, Head of Data Science, you're right in the thick of it. What factors do you need to consider to use AI?
Well, I think AI is just another science, right? And so when you're thinking about adopting AI, you've got to consider evaluating it in the same way you would other sciences. So, when AI is trained, it only reflects the data and the way it's been trained on. And so if your population is significantly different to the data it was originally trained on, or for example, if your imaging technology or other medical equipment is significantly different, we know from our research that AI can very easily distinguish between different kinds of imaging technologies. And so there's opportunity for it to cheat. If you train an algorithm on two populations, one is on one machine and one is on another machine, and one has a really high rate of cancer and might be a secondary care provider that does specialist cases. All of a sudden, the machine learning algorithm can say, hey, shall I learn what cancer looks like, or shall I just learn which of these images was taken on a different machine? And if it can cheat and it's easier, it will. So it's important to understand these kind of factors. Is the AI going to be reliable? And also, do I understand what it's predicting? Is this saying what I think it's saying? And so being able to interpret it well and understand how it was trained is going to help you in applying it successfully.
And Simon, just thinking about perhaps some of the regulatory issues that you can see or Microsoft has had to overcome to get to where they are at the moment?
So regulation is really interesting. I'll parse it into 3 tiers. So in the US FDA, I think they're one of the more progressive because they were criticised in the early years for holding back innovation. And their model of making sure that technology products that came to healthcare were safe and reliable was certified at a point in time, freeze it, make sure it doesn't change, and then how about you come back and recertify it if it ever changes? Well, the challenge with artificial intelligence is it just changed. It just learned. It just changed again. And how do you keep an eye on that? So the US FDA has been quite progressive in their software as a medical device regulation and their pathways for doing that. And there was a landmark case in 2018 where IDX-DR was a diabetic retinopathy interpretation algorithm that was certified for use with no doctor in the loop. So it can autonomously read retinal images, identify whether there's diabetic retinopathy without a doctor in the loop. That's pretty seminal. But when you look at Australia, the TGA, instead of asking each individual algorithm to be approved, you can have a bundle of algorithms for an outcome, and the outcome is certified. So that's a different approach. And then in developed worlds, they're entirely less regulated again. And so we're actually seeing that in some of those developed worlds where they might not have a reporting radiologist available in that area, they can actually get immediate value, understanding that there's risks associated with it, but they can provide value more immediately than they're able to today. So I think the regulatory environment will continue to evolve. The regulators are struggling to catch up as quickly as possible because this technology is out of the bottle now and we're never going to stuff it back in.
Teri, I see you nodding there. Do you want to add some comments around the risks that we're facing for AI and what's perhaps holding it back?
Absolutely. You know, thinking back to your initial question to ChatGPT, I disagree with the answer. I actually think that AI is firmly in the healthcare process, that it will replace diagnosis in some cases. And radiology, which is, you know, mammography is our area of focus. I think that there is no reason that there won't at some point, and not really far away, be a situation in which we can take all of the information that we know. For example, what is the density of somebody's breast? Very low. What is the visibility of any potential tumors? Run multiple CAD scores? Very low. What are the risk factors for this patient? Very low. What is the quality of this image? Very high. Gosh, does somebody really need to look at this? And when we look at why do we train our doctors, what are we trying to do with them in an area that has a significant and increasing staffing shortage, let's get them looking at the borderline things, the hairy, ugly things, the ones where you've got a lot of interpretation necessary. So from our industry, I think that this is going to happen. I think, though, the data that ChatGPT is basing its analysis on is the now. I also think back to my science training, and I remember having it absolutely drilled into me. Correlation does not imply causation. So, for example, to smoke a cigarette, you must breathe. Does smoking cause breathing? So when I look at conclusions that are made from AI, we're at an inflection point and we are going to see it take off. And the key thing is when it's in that exam room or it's in that reading room, using it as a tool. And I think in the future, radiologists will still be around. That specialty is not going away. But the radiologists that don't use AI are going to be in a world of trouble. So to me, it's extremely exciting. On the regulatory question, I've seen, you know, there are some companies, CAD in our industry has been around for just over 20 years. So AI isn't new to healthcare. It's improved significantly, but how it's applied when you look at a complicated situation with multiple comorbidities where the art of medicine is suddenly important. That's where the clinician uses this as a really strong tool, but is still really absolutely required. And the challenge, I think, historically has been the quality of the data. There's been some hype out there about, yep, this is, I think 5 years ago, somebody said it's going to replace all radiologists. No, it's not going to replace all radiologists. However, making sure that it's valid, making sure that you can understand where this information comes from based on good, solid data, I think going through those regulatory hurdles will weed some of the less valid correlation, causation, hype kinds of vendors out there, and there will be a certain number that are core. And then the last comment is when I look at things like ChatGPT, it's super easy. It's applicable to lots of areas. It's easy to operationalize. So when you look at AI as I'm just going to get an algorithm versus AI providing significant value in my workflow, it's easy value in the workflow that I think brings it to the next level of mainstream use.
Simon, I think you had some comments.
So it was really interesting to hear your thoughts about the future of AI in healthcare. And I just want to baseline that AI has been around for a long time in health. When I was practicing as a doctor in the year 2000, the ECG machines that would spit out your heart tracing came with an automated interpretation. And the cardiologist would say, don't trust the machine, always come to a cardiologist. Well, you need to get that checked. And at the time they were right, the algorithm wasn't perfect, but also cardiologists would get paid to interpret ECGs. Now fast forward, cardiologists in general don't get paid to report all of the ECGs, but people still have hearts and people with heart disease still need treatment. So the role of the cardiologist has changed, and I would argue it has moved to the higher value interaction in discharging their care as a cardiologist. You talked about the art of medicine. I think the art of medicine is the very human side of how do you generate rapport and trust with a patient as you deliver news and interpret that and check for questions. How do you be accountable for the decisions that you decide to do and then follow through and manage that risk over time? An algorithm can't do that. You can't hold a machine accountable. And I guess the final thing is the ingenuity of humans when you need to think outside the box. If the cardiology models are all trained in normal pathology and now you've got a dextrocardia, someone with the heart on the other side, the AI algorithm might say, well, there's something terribly wrong here, and the cardiologist will say, no, I know what's going on here. So I think that art of medicine will be the human side of things. But the science of medicine, I think, is increasingly being quantified as we collect more data, as we use computational power to interpret that data, and then we use the speed of computers to come up with insights that would take humans a much longer time to do, probably at more expense as well.
Nick, you...
The thing I want to add is around the speed that we're moving, and all sorts of thoughts around Moore's law and the various analogies of technology and speed. But if we look at, and we're talking ChatGPT because it's obviously very topical, within a month of that technology being released, I was hearing Jonesy and Amanda talk about it on the radio. The speed at which it went mainstream was phenomenal. That is, to be honest, one of the key barriers with the adoption of some of this technology, because at the moment we're still learning about it and we're still learning to trust it, and there are occasions where it goes wrong, and that makes the headlines. There is a lot of problem with, and you mentioned it earlier, explainability. The ability to explain how the AI got to the outcome that it has come to. And that is a key piece of change management that needs to happen with the adoption of any AI into a clinical setting. The people who are going to be using that technology need to be comfortable that the outcome that it's come to is the same one that they would have come to if they had more time. Or better, indeed. And at the moment, I think that trust journey is we're still in a very sketchy phase of that. People are still learning to trust some of this technology. And that is probably, when I think about the challenges and the barriers in terms of where we go, that's probably the biggest one I've seen. And I've certainly seen companies invest a lot of money, but not take the people they were going to deploy to on that change journey and that understanding and that explainability. And as a result, when they tried to deploy it, it was resisted. And so for me, it's really about mastering the art of explainability, of course, making sure we've got the right data sets underneath, but then being able to explain the outcomes. And that's being regulated in certain markets. Yeah.
Lester, do you want to make a comment on that?
Yeah, that'd be great. So I think, it's a really good point from Nick. Like, I think if we want to build trust in AI and the medical domain, there's a couple of things we have to do. I think firstly, we have to have algorithms that work in the real world. And we saw this with COVID was a great example. Hundreds of algorithms developed on chest x-rays. None of them provided any use whatsoever clinically. And the reason was they were built on small academic data sets that reflected one machine, one population, one small set. And the algorithm learned to memorize them rather than being able to generalize. And that's the trick with machine learning, is trying to get general things that are robust to noise. And then on top of that is to produce good, high quality prospective trials where the algorithms is evaluated by third parties. So it's not me developing an algorithm and then saying, trust me guys, it's really great. It's passing that algorithm to third-party researchers. They run it on their data set, of new data coming in, and publishing the results so clinicians can read it and see that, hey, in the real world, on real patients that were coming through, this is the difference that it made. And I think doing those things, having real large data sets, algorithm development follows the development of data sets. We see this across industries, and even within healthcare, the algorithms are growing where the data sets are growing. Those countries that build big digital data sets are the same countries that build great algorithms. So building more robustness, doing high quality trials, and then offering a way to interpret or something quantifiable for the clinicians is all going to help to build that trust and help adoption.
Lester, while you've got the microphone, I'm just wondering if you could perhaps look over the horizon for the next 5 to 10 years, given, again, you're sort of at the leading edge of a lot of this development. How do you see some of those applications emerging, and what might they be?
Yeah, so what I'd really like to see is, I think, two things. Firstly, is a development of more generalized models. And I think to take the ChatGPT example, ChatGPT was kind of the same thing that was happened already, but turned up to 11. The size of the data, the size of the engineering was just massively bigger. And that made it more robust and more magical. So in the medical domain, I think the equivalent is really big data sets with more than one modality. And what I mean by that is not just X-ray, not just patient history, not just clinical monitoring, but all of those things starting to come together to help an AI more generally be able to understand the patient journey and what healthcare can do. And so the development of large multimodal models, I think, would be a really exciting development, and one that could be the ChatGPT moment for healthcare. And then the other thing I'd like to see is AI being combined with new imaging technologies and primary care, so more people can be seen sooner. We have huge pressure on the staff and skill shortages in the healthcare domain. It would be great to see AI being able to make a difference so that more people can be seen who wouldn't otherwise be seen, and being able to do jobs that people don't have time to do or might be too overwhelmed to do. So this might be monitoring hundreds of patients at a time in a busy hospital, or being able to exactly quantify the risk of people coming through the door of a primary care provider that you just wouldn't have time to do otherwise.
Can I add something on this?
Absolutely, Teri, go for it.
Like, ooh, pick me. For healthcare particularly, a level on that, not only just reducing some of the load on primary care. When I look to the future, what I want to see and what I fully expect AI will help us get to is, instead of a healthcare system that is based on fixing what's broke, let's get much more focused on prevention. So when I look at one of the founders of Spotify heavily investing in full body scanning and this concierge care approach where we try to understand a person at a much, much deeper level and what might be their predisposition to developing certain things, and can we prevent that from happening, provide very personalized care based on an enormous amount of data that we could use that right now we're not using much. So when you look at the growth of imaging, which right now is absolutely taking off as a diagnostic modality, moving that to actually imaging for prevention, and then throw genetics into it. If you want to sprinkle the microbiome research on top of that a little bit too, enormous data sets, but that's what computers are for. And so, ultimately, yes, I want to reduce the workload of primary care doctors. I want them to be able to get assistance in diagnosis. The amount of new research insights in medicine is far more than any doctor can keep up with on their own. But the best scenario is that we keep people well and we keep them home and we get on top of it before we have to fix what's broken. I get to drop it now?
I want to add straight in. I love this concept of aging in place, right? This passion that we all have about aging in place. I think we're all scared of having to go into an acute healthcare setting, but the reality is that healthcare at some point in time is going to touch all of our lives. In fact, probably has touched all of our lives when we were born and through various illnesses. So if we think forward 20 years, we're all probably going to be a little bit more dependent on healthcare than we are today as we age. And so therefore, all of us want the healthcare system to improve. It's in all of our interests. And for me, I've got obviously a different lens because I think about the operational application of AI. And so for me, I think about the conversational agent capability that could be there supporting a clinician to plan out a personalized care journey for me, right? As we identify early, hopefully, not after these things have happened, the care needs that I have, being able to augment the clinician with all of that knowledge in a way that the clinician can easily access in a friendly way, like being around the coffee we were talking about before, like being around the kitchen and having a coffee and talking to a colleague and then thinking on brainstorming of, oh, hang on, maybe I'll do this. You could do the same thing with a conversational AI capability that has at its fingertips the search capabilities of the entire data set that we talked about a moment ago. And so that for me is just a beautiful vision of the future, because that says we're going to care for people people in a much better way, in a proactive way, and we're going to keep you in your own house rather than bringing you into a hospital. And that's where I would love to see us get to in 20 years. It's a lofty ambition, but that's where I want to go.
Can I have one last twist on that? I have to add to your care at the home and your concept of lots of data. Did you know that the biggest predictor of if an elderly person is doing okay or trending down is their water use? So imagine when we're trying to keep people healthy at home, if we even had access to, are they getting up, taking showers, doing the dishes, doing laundry? So profound possibilities for keeping people healthy in the future.
Simon, if I could just ask you a broad question about Microsoft, massive company. How do they think about healthcare in terms of, is it a silo? Is it very much a part of their sort of growth trajectory going forward? I mean, how does it sort of fit into the Microsoft psyche?
You bet. So Microsoft is a cross-industry company, and it means we can stack rank and compare. So of the digital leaders, I would put retail, finance, travel, even manufacturing up the top end as early adopters of technology. And then public sector, health and legal, I'd probably put down the back end, documentation heavy, sensitive workloads with established practices. But having said that, health is data intensive. The legacy systems that we have frustrate good quality care and aggregation of information that does need to come together. And so for every tech company, when they look, especially in times of approaching recession, health is the industry that will just keep on going and has great potential. So we've been verticalised in healthcare for 35 years. We've got about 1,500 people, doctors, nurses, PhDs around the world. But in the last 3 years, our approach has changed. Rather than just putting horizontal technology into healthcare and having them use it just as any other industry would, we are pre-configuring environments that are ready for healthcare data and provide templated workflows so that you can do things like virtual care, patient portals, remote patient monitoring, that sort of stuff. And if we can do the hard job of the boring infrastructure, then people who are innovating can innovate at the top edge where it belongs. And we started doing that with data centers. Once upon a time, you needed to get your own hardware, provision it, maybe own your own data center. Well, these days, the hyperscale cloud providers do that. They run data centers at scale with security embedded, and you don't have to think about that. You can get on with the process of the top of license type stuff. So where do we see healthcare going in the future? April last year? April 2019, I think. Whenever it was, Microsoft acquired Nuance. And that was a big shift in terms of our approach to healthcare as a first-class vertical. It was Microsoft's biggest acquisition, I believe, and Nuance is a voice recognition leader. How would that come together in the next 10 years, perhaps? I can see a day where rather than seeing a patient and then spending the next hour doing documentation, writing it up into a note with referrals and placing orders, I can actually see that happening as a byproduct of an agent that listens into the doctor-patient consultation and then structures it in such a way that now a doctor can get on and see more patients in a day, that nurses aren't walking around with the pen as their most important instrument, and then we can free up clinicians for patient time.
Great.
You made a phrase in there where you said we want to do we just get the boring technology sort of taken care of so smart people can do the things on top. I disagree. The day Microsoft turned on NLP Analytics within Power BI, you should have seen the data science team, right? They were so excited because suddenly we were able to do NLP-driven analytics. Now, people are going to say, what on earth do you mean? I can type something in using natural language. Who was the most expensive patient in the last last 3 months. And the analytics engine just pops it out. Or if I wanted to do a graph of, what are my avoidable admissions in the hospital over the last 3 months, the smarts that are in the product now will just dynamically generate that analytics. And it just allows us to step up and do the next level of analysis. So it's not boring tech. I just want to it's not boring.
I just wonder if any of the panel have got any insights or comments on which particular countries are doing AI better.
Who wants to go
Should
first?
go, Lester.
Yeah, sure. Yeah, so my view is where we're seeing AI succeed is around places that have got maybe 3 things right. So the first is a good regulatory framework, and I think the most progressive countries, so I'm thinking about South Korea, some of the Nordic countries, have got regulations that treat software as a medical device a little bit differently to hardware. It's not to say that they're less stringent, but just that they allow for more rapid development. I think the second thing is countries that digitize their health systems. As I've said before, algorithms are built on data. The more digital data you have, the better your algorithms can be. And so, again, South Korea was one of the first countries to digitize their healthcare, and also one of the leaders there. I think those are 2 really big factors. And I guess the last factor to draw out is about the attractiveness of the market. If you're a small country with a small addressable market and you have a lot of regulation, it's harder to justify as a commercial company to go into that market. If you take the US, obviously they have a vast healthcare spend and makes it much more attractive for algorithm developers. And so I think you see a lot of innovation in the US as well because of that.
Nick?
Sure. So let me take the question in 2 different ways. One, around who's investing, who's moving forward. I was doing some research the other day on papers that are being developed by various countries, and Australia has, I think our number is 2.7% of the global AI research papers. So we're pretty small. When you look at our per capita, okay, well, that would sort of make sense. But then you look at the US, who are releasing 30% of the research into AI and the papers that are being published. And it's just an astronomical figure in terms of the investment dollars that are going into universities to study this topic and come up, as you say, with new algorithms. So they're well advanced in terms of that money that's going in. But there's another side of the coin as well when you look at the money that's going into the digitization of the healthcare systems. And one of the things that I'll highlight is the UK's decision to invest, I think it's £3.6 billion into the frontline digitisation of the NHS trusts. And the goal there is that they'll get most of them up to HIMSS level 5 by the end of 2025. Now, that sort of investment into digitisation of the healthcare system provides the opportunity for us to introduce AI technologies that we've built into our platforms. So for me, that sort of investment into the transformation of the healthcare industry provides that platform for AI investment.
I'm going to comment a couple other dynamics related to the United States and AI in healthcare in particular. It is interesting, like the comment you made about the value proposition and what you're reimbursed to do or not do. In the United States, you do have to follow the money. There's a heck of a lot of it there. They spend far more on healthcare than anywhere else in the world, and their outcomes aren't far better. So there's some pressures to be able to change that equation. However, there are also a couple factors that are fairly unique to the U.S., highly litigious related to healthcare. And the role of AI can be seen as good or bad when it comes to medical malpractice. So at one level, one of the reasons that CAD really did take off 20 years ago in radiology was it was something that a radiologist could point to and say, well, this is what I said, but the CAD backed me up. Also, it was reimbursed. Now it isn't anymore, but you've both had to follow the money, and I've got something over my shoulder that I can look at. But CAD was never the point of doing the diagnosis. It was supporting what the radiologist did, but never was it saying this is what it is. So the liability still fell on the shoulders of the healthcare practitioner. We are entering a new world, though, and there's a lot of uncertainty in how this is going to be resolved. Right now, we've got a team of people who are looking at the legislative environment in the United States for when AI actually goes to the point of making a diagnosis, and what has happened in the areas of healthcare where it has been able to cross that line to no further human intervention needed. And it's uncertain in radiology right now. It will need to be resolved. I believe it will be resolved. But for you investors looking at, is this really cool new company going to take off in this direction? Do keep that in mind. That's a significant hurdle.
I've got one more to add to the mix, and probably another factor. I've noticed that Israel pops up disproportionately on the international scale of things. And you mentioned South Korea. I wonder if there's not something about the intelligence infrastructure required to maintain their domestic security that isn't transferable across to other areas as well. So,
yeah, some very interesting comments there. I'm just going to check, are there any questions at all from the audience? I sort of got a list of questions up here, but we want to just try and keep it fairly interactive. Is there anything, Derek? I know you've always got a question.
I think Teri hit on it. I think the problem is that
I'll just come down with the mic.
and we'll repeat the questions too.
Yeah, sure. Thanks, Scott. I think Teri hit on it. The problem is the accountability and litigious nature of the U.S. Totally agree, get it. And this is a new shiny toy, and we've all been in this field a very long time. And I can tell you when this CAT came out 20 years ago, that was the greatest thing since sliced bread. EKG is the same thing, but how long did it take those technologies to become adopted and put into standard of care and workflows? A long time. So we're here talking about ChatGPT. Looks exciting. This is great. This is wonderful. We're all going to be saved. This is great. How long is this going to take? How much is it going to cost? And let's face it, at the end of the day, the buck starts with the payers. Who's paying for this? We can design all we want, but at the end of the day, it's really the governments, the insurers are going to balk and say, unless you can show me some really better outcomes, this is not going to change. But I guess my question is, how do we change? And I've always been of the mind, given that if we're all medically trained, your education is quite siloed. You know that your job is about volumes, not outcomes. Unless you change that on its head, how's this all going to work?
So I'm going to have the first bite at that cherry. My hit prediction is generative AI will come relatively quickly to healthcare, and I'll tell you why. Health is a lagging follower of trends that happen in general society, and it's true. Artificial intelligence has been around for decades. But I think this is the year it's going to go mainstream. It's kind of like mobile computing technology was around forever until Apple debuted the iPhone, and all of a sudden the technology was democratized. There's one conference I'd encourage you to watch very closely this year. It's next month in the US. It's HIMSS in April. And I think generative AI, there's going to be a lot of announcements from big tech. You're right, though. How do you find the valued use case? And there's so much manual potential in healthcare to automate. And one of the things is, how do you turn narrative text into structured codes and then use the structured codes for reimbursement? That's called clinical coding and case mix. And you need to go to university for years to become a health information manager who can do clinical coding and case mix. We're very close to being able to replicate the sophistication of what they do using some of these new technologies. So I think that's one area to watch.
But why do you think the field in general is a laggard in IT adoption?
So here's my view about healthcare. Really sensitive data, high degree of resilience of systems with a low tolerance of uptime, historic underinvestment compared to some other industries, and then industry-specific nuances. So healthcare has always said, no, we can't take your CRM. We need a patient administration system or an electronic medical record, because we're health, we're different, we're special. And it's true that health does have nuances, but I think even though they've converged, we're going to have to see health come into line with the rest of how other industries are developing.
I was just wondering if you think it has to do with our training, silently trained,
It's cultural.
culturally trained in a very deep silo, right? And we're graded like that.
Yeah.
It's your education, it's your merit that gets you ahead. So how do we all of a sudden have interoperability and we're all happy as a big team now?
Yeah.
So is it a cultural thing, and how does that change?
So I think healthcare is really good at adopting capital technologies, the latest surgical robot or a gamma knife or scanner. But as far as information technology innovation, that has historically sat outside the clinical domain. The clinical leadership driving information technology use and adoption has been lacking. As we become increasingly digitised, that's being recognised, and clinicians are stepping up to have legitimate roles in digital health. So I think that's a change, and it needs to go further. I hope that we see clinicians start to drive digital change, and not just turning paper into digital, but how do you actually use the potential of technology to improve healthcare processes and outcomes.
I think you actually hit on something that's very important and wildly underappreciated. There's a book, I believe it's called The Hippocratic Myth, and it goes into the history of healthcare. Fascinating. So if you wind way back to before medical schools, we had snake oil. We had carnival salespeople with miracle cures and cocaine and everything. And there were a lot of people hurt by the, field medicine and people trying to sell whatever the latest and greatest thing is that didn't have the science behind it. So there was actually a very deliberate process of creating medical schools that used Latin and Greek and terminology that the lay people couldn't understand in order to protect people from themselves or from the guy coming in the wagon selling snake oil. And so we built this process of making it difficult to understand and not approachable. And now here we are trying to get to the point of making it approachable again. And so there's been a cultural, we need to protect people from what everybody else is doing because medicine is special. And now with things like open notes in the US, suddenly we're actually exposing the charts to patients. There are initiatives where the healthcare organizations are teaching their clinicians to start using English again, because patients are actually reading their notes, and not all of them want to or ever will, but some of them will want to be empowered, or they'll follow whatever Dr. Google says. And Dr. Google doesn't always give you good recommendations, just like ChatGPT won't always give good recommendations either. And so we've got this enormous hurdle that we need to get over based on the history of how medicine evolved. So that's one thing. So I think that a good thing to watch. But I think we are moving. It is changing. The other thing is, in terms of applying AI in healthcare and why it's lagged, clear value understanding. And some of the value is reimbursement, CPT codes, but some of it is, does this slow me down or speed me up? When I, a doctor, have pressure to see far more patients than I think anyone should ever ask me to see in a day, I'm feeling anxiety because I can't spend enough time with all of them, but yet if I see less of them, it's less money in my pocket and I can't go to Aruba on vacation. So that's my life. That's just what happens. And so if we don't find a way to leverage AI, not just to provide more stuff, but actually to provide ways to do the right thing faster, nobody cares. Or I shouldn't say nobody cares, but it's not going to hit mainstream. So to me, that's the inflection point we're at, is to go beyond what is this algorithm or what is this new discovery that we found in a lab that we researched with a small number of people at a university, but what is something that is going to be easy and mainstream in improving the lives of the clinicians that are on the front line. And that's what we're working on. That's what we think is where it's going to shake out and make a significant difference.
Wonderful lead into what I want to say. There's a couple of stories I want to tell here, or data points. There was a survey just done recently of nurses that suggested that 50% of nurses are looking for a new job somewhere in the next 5 years. They are so overworked and exhausted from what they've just been through that they're looking to get out of the industry. And that is frightening in terms of workforce challenges that we're going to have. That was an Australian piece of research that was done. I work closely with a number of nurses, and one of them told me that before her shift, she didn't drink water, and she didn't drink during her shift because she couldn't afford the time to go to the toilet. And that is just an astounding piece of information to think about when you apply that to our nursing community. It's absolutely frightening. So when we talk about using this technology to help people do their jobs and, meet the demand of what's coming through the door, I think that's really important. The other piece of information that I want to respond to with the question, or the thought that I have, is I fundamentally believe that the consumer adoption of technology will play a big role in the transformation within the industry. So an example is symptom checker capability that's now available via websites. The ability to go on into a chat capability and say, I've got a headache, it's in my frontal lobe, all these things. You can put it into a symptom checker and the symptom checker will pop out and say, you know what, I reckon you should go to hospital. Or, take a Panadol and go to bed. So this is already capability that's out there in the hands of consumers. The fact that we've got predictive text capability as we're taking notes in our phone, and then I go into the EMR system or and I'm typing things and I'm not getting that predictive text capability, I start to complain. So the fact that we in our lives are starting to see this technology come out puts pressure on the system developers within the healthcare environment for us to catch up with the technology that's available out there in our consumer lives. So those 2 points for me are big points that are going to drive technology adoption within healthcare, but it is a massive industry to change. There was a report that was out years ago saying that healthcare was going to be the biggest bang when we got to digital transformation, but it was going to take the longest to get there, just simply because some of the challenge that you talked about in your question. Yeah.
I want to add something. Also on following the money, and is it reimbursed or not? It's interesting when you were talking about the role of consumer and consumer expectations. There was a study done recently that asked about trust of AI in healthcare and do patients trust it? And I thought it was funny because it said, kind of 50-50, a fair number do and fair number don't. And it was somewhat worded based on trust AI to make a diagnosis. And there's a difference between AI being your doctor and AI assisting your doctor. But what I thought was really fascinating, though, is, even this was research, and so this was started years ago. And even if it's the latest research, it takes quite a while from when you ask the question until it's published. That was published before ChatGPT. So now we have a customer, RadNet, and RadNet is rolling out a program they call EBCD, and it's Enhanced Breast Cancer Detection. And EBCD actually packages up our Volpara risk pathways, so, figuring out somebody's lifetime risk, asking some questions, giving them a tailored plan, their own AI in the form of their CAD product. So they say that the radiologist is going to look at your image and AI is going to look at your image. And then some supportive information, packaging it all up together. And when they schedule an appointment for a mammogram, they ask the person, do you want to just get the result in the normal way? We'll tell your doctor, negative or not, or do you want this program, EBCD? And if you want this program, pay us $59. We're not going to submit it to insurance. And here's the thing, they released their financial results recently, and they're projecting $12 million from EBCD. So they're getting positive uptick. Patients are paying for it. And if patients are paying for it, that means patients are seeing value. So to me, this is just one more data point that we are at a point where the way that the public looks at AI in healthcare is changing.
Can I put that in my life? I'm going to take that example and apply it to a practical example for you. My wife is currently in a boot. She went over on her ankle while we were doing a hike. She has had x-rays, CT scans, MRIs. All of the scans were done within a very short period of time. How long did we wait to see a specialist to try and interpret those? It took us 2.5 months to get to the point where the specialist could see her, to look at those images and tell her oh, you should go and have a cortisone injection and then come back and see me in 6 weeks and maybe I'll operate. Now, if I could have gone on to an application and submitted those scans and paid some money for AI to give us an early diagnosis of this is the action you need to take or that we recommend that you take, I would have paid that money without doubt, because she's in so much pain. Being able to bring forward the care intervention or the care path that we should follow is worth me paying that money.
It is all about the value.
So I might make a comment on this question. As I've been involved in developing AI models for both healthcare and in other industries. And so if I contrast the two, what is it like? Well, you know, when I worked in e-commerce, for example, we had models that retrained 6 times a day. They had metrics, and if they passed the metric, they'd automatically be deployed and go straight out. In healthcare, you can't do that. Why can't you do that? Well, the cost of failure is just much higher, right? Like if we recommend the wrong dress to somebody, maybe they don't buy it, it's not a disaster. You recommend the wrong cancer screening procedure, it could change someone's life. So I think there's some necessity there. The other thing that we had in other industries is a closed loop. So we had this ability to go right from data to deployment to measuring the outcome and seeing how well the model did, and taking that outcome, putting it back into the model and getting this virtuous loop going where the model learns from how it's being deployed in production and gets better and better and better. And you can sit there and do virtually nothing and see your model getting better and better over time. And I think we've got to find a way of doing that in healthcare. You know, we have to be able to trace the predictions we make right through to clinical outcomes and be able to use that data to redeploy the models and make them better. So I think where we're going to succeed is where we manage to close the loop. And also the other thing is solving the infrastructure problem. You know, a lot of big companies that are doing AI in other industries have in-house teams. They can deploy stuff on their own infrastructure. But in healthcare, you have to have a way of being able to efficiently interface with hospital networks or clinic networks. And, you know, that's where working with somebody like Microsoft or, you know, having kind of interoperability kind of tech stacks can really help with that plugging in.
Just check, are there any more questions at all from anybody in the audience? Great.
Question for Teri. Teri, how did RadNet approach the litigation risk with what you just talked about? With regard to the program that they're rolling out, EBCD, how did they approach the litigation risk of saying to a client, well, you know, you can take a human's view or you can take a machine view, and as one of the other speakers, Lester just said, the risk of failure is exceptionally high.
Mm-hmm. They still maintain the ownership of the risk on the shoulders of the radiologist, and they use the AI as a virtual second opinion. So a radiologist still reads the mammogram, but then they say, you get a read, and then you get a virtual second opinion. And if there's a disagreement between the read and the second opinion, then you get a third opinion. So they still manage the risk, doesn't go onto AI or become ambiguous. But it's an additional layer beyond the traditional radiologist reads it, moves on.
How is that going to translate to them in over the next decade in terms of, you know, return on their investment for that ECBD?
Well, since patients are paying cash for it, it's you know, they pay far more than the cost of having AI, and AI is far less expensive than adding 2 or 3 radiologist interpretations to each mammogram. So they feel like the ROI is very solid.
Okay. Just switching tack for a bit, talking about primary healthcare, and that's a bottleneck. I think that's widely recognised. Can any of you suggest a practical method by which AI will find itself present in the GP's office to try and increase the throughput where that is just, you know, just a huge bottleneck globally?
So I was involved in a project that came up through Microsoft Research called Empower MD. They partnered with the University of Pittsburgh Medical Center, and the concept was, can we eliminate scribes, medical scribes? The fact that we've got people listening to the recorded doctor-patient consultation and then typing it up into a pre-formatted note, can we do that through AI? Turned out to be a lot harder than we thought it was, but we validated it for a particular discipline. Now, it was cardiology, it wasn't primary care. But having validated the hypothesis, Microsoft then graduated this concept to intellectual property that we could then offload. And it was Nuance who acquired that technology. And now they've turned it into a product called Dragon Ambient Experience. And this is available in North America at the moment. And it does exactly that. Listens in on a doctor-patient consultation, marks up in near real time a structured clinical note, and then the doctor can go in and change stuff in it if they want to, and then the algorithm learns. So that's scaling out at the moment. When I think about primary care, and I think about the scourge of 6-minute medicine, where doctors want to spend more time with patients, but there's a throughput required to do it. If we can take off the onus of the documentation, now we can free up time for doctor-patient care. So I think that's one area where it might have value. Another is pre-consultation documentation. So typically we expect the doctor to capture all of the stuff during the consultation. But couldn't you have patients pre-fill some of that? And I'm not talking about in a clipboard in the waiting room, but couldn't they use digital ways of capturing some of the information that they want to talk about into a formatted note that then the doctor could read through? There's scope and potential for artificial intelligence to do that, to streamline the consultation so that the time spent with the doctor is high value.
Yeah, well, I put it to you that the AMA in Australia won't adopt that because it'll take away from the profitability of their members. So, I think that the AMA here is just a huge, huge obstacle to all this technology. And until they get on board, and I dare say it's the same with other regulators around the world and other professional bodies, they won't even let pharmacists administer flu shots. So how on earth are they going to get,
Scripts already use that in Australia.
Yeah,
so
but, my point is that they're resistant to the adoption of technology. Yeah, that's my rant. Thank you.
That's my colleagues.
Got to say, there's a product in market called Better Consult, which is actually deployed in Australia right now. It's owned by HealthShare, and it's well adopted to do that pre-clinic consultation. The second thing is, as an ex-AMA member, they try and do a consensus view and represent the interests of doctors and what they want. If the collective sense of doctors is, we want to be spending time with patients rather than time in computers writing notes, then that will become the articulated position of the AMA. I hope. We'll see.
I'm wondering how many people in here have in their lives at home a device that rhymes with Malexa or Dot or any kind of personal assistant where, set the timer, do the lights, can you do this conversion for me, play my favorite music. It's integrating into our life. And I've seen what Dr. Kos was talking about, even in my former life at Epic more than 5 years ago, in primary care, to be able to say ambient documentation, update patient's past medical history to include. And those words of update, these 3 things, boom, it's appearing on the screen. So the technology is there. There's some change management and investment associated with how quickly it comes to Australia. However, I think that the key thing is the value proposition is becoming progressively more clear and the risk is becoming mitigated enough. And then that you mentioned earlier, all of us are starting to get more trust in how to incorporate these into the workflow of living. And so the expectation for a doctor, primary care GP, is that this is part of their living.
I was just going to add, I think the pressure might come directly from consumers, like how many of you have Googled your symptoms before going to the doctor? Certainly I have, and I think most of us are guilty. And you come along to the doctor's office and you go, I think I've got this. And they go, wow, it's probably not yellow fever despite your symptoms. And I think we're going to see something similar with AI. I think, obviously it is a regulated industry, but, it might start somewhere like with skin cancer, something really that you can do easily with your phone, take a picture of a mole, and there'll be an app that gets around the legislation that goes, hey, this looks high risk or low risk. And I think consumers are going to adopt that because there's just a demand for it. People want to know, and if there's information out there, from the research, for example, we did on breast arterial calcification, even though it's tricky to interpret for clinicians, when you ask patients, do you want to know if you've got calcified arteries from your mammogram? Over 90% said yes, even though they don't know how to interpret the information. Everyone wants to know, right? And so when the tools come out, I think you're going to start to see demand from consumers, and I think that'll put pressure on primary care providers.
I'm glad I'm at the end. One of the other areas that I was thinking as you asked the question was in decision support. And in how do GPs stay abreast of the latest research information that's out or the latest development in drugs? And if we're able to more efficiently feed that information in, even during a consultation. So if notes are being taken and we can use that in a dynamic way to understand, okay, well, this is what's being said, this is the latest research that's out there, here's some things to think about. I think those sorts of things are going to be very powerful in the primary healthcare space in helping GPs stay abreast of the latest and greatest things. Now, if we can do better diagnosis early on, then what we can actually do is reduce the cost of that patient then going through the healthcare system because we've managed to catch something early. So I think those two things for me are key ways that we're going to impact the primary healthcare system.
Just check, are there any more questions from anybody in the audience? Okay. Right.
I think I was going to say we've got time if there are. Don't feel like you have to run away.
I think would be fun to address is what can AI not do? What we were talking about earlier.
Go for it, Teri. What can AI not do?
We had a hearty debate before you all arrived about where will healthcare adopt AI, where will AI stop. And one of us said that you go to the doctor to get empathy. And then I'm thinking there's some new apps out there that are really, really good with empathy. And there's some apps that are meant to reduce loneliness. My son actually was showing me how crazy human-like some of these apps can be, that you have a virtual friend. And there are times I talk to the wall because I'm a verbal processor. So I can get value by talking to a wall. Oh God, what happens if I start talking to the computer? Man, so is it that? There are certain things, though, that I think the art of medicine will pull in and will continue to be necessary. So when we look at what are the things that you really, really get significant benefit, it's some of that complex medical decision making. It's the zebras. It's the diagnoses that don't fit the usual. There's human connections. So the care of healthcare, there are certain pieces that I think are likely to continue but evolve into a different direction. You want to comment on that more?
Yeah, sure. I guess the way I see it as a limitation is, it's a limitation and a benefit of AI is we think of it like an analogy for the human brain, but it's different in a couple of ways. And I think one of the ways it's different is AI doesn't really reason yet. And, you can't compare different concepts and turn them over in your brain as an AI. It's pattern recognition, right? It can be very good at recognizing patterns, but it's directly from a pattern to a conclusion. There's no, I've seen this and I've seen this. And, 6 months ago, I had this kind of case. And that makes me think that, this is not how it works. But the other side of that is AI is very good at scaling. So it can pattern recognize over 10,000 different diseases. And no human can turn over 10,000 different options, right? And you know what it's like just deciding if there's 10 restaurants in the street, trying to decide what to have for dinner, even that's hard. So I think, the cases where you need lots of context to compare things in a very subtle way, I don't think we're going to see AI take over there, but we are going to see it where, one thing scales out to many options or to many patients at once, or, monitoring 500 patients in a hospital at once. I think, that's the other side of that.
What it can't do. I struggle with that because I just think given time, it's going to be able to do so much. There's a fascinating study that was done a few years ago on PTSD and using an avatar to do consults with soldiers who were returning with PTSD. And what they found was that the soldiers actually preferred talking to the avatar rather than a human psychologist because they felt they could offload onto the avatar. They didn't feel like they were burdening another human with the traumas that they were going through. So that goes, it was a really surprising outcome, but an amazing tool, and shows the power of the technology. So I struggle with what it's not going to be able to do given time. I think that when I look at some of the problems we're trying to solve with bed block and patient flow through a hospital, and we were talking about this the other day in our team, just thinking about how do we identify a patient's needs as they're coming through the ED. We predict what type of bed they're going to need to go into. We can then get all of the data about the hospital and what beds are available and what beds have certain capabilities. Is there a patient in that bed? Does that patient need to be moved? All of these things we can start to build out with what we can do. So I absolutely agree that there is a human empathy and a human connection in the art you were talking about before, the art of medicine, that is going to be very difficult to replace. But in terms of the mechanical decisions that we have to go through, that can be very complex and, as you say, scaled, I struggle to come up with ideas of where it'll struggle to do those things given time.
I knew you'd do that. So I tell you what AI can't do yet. AI can do so much more than we are ready for it to do, and it can't come up with the validated models of care and evidence. So I can see how artificial intelligence could crowdsource all of your consumer-grade medical devices, pipe your biometric data through to your doctor, and your doctor will be like, I don't know how to interpret this. I was trained to take blood pressure once every 6 weeks and then make decisions over a 3-month time frame. What does this mean about this heart rate variability, the area under the curve? What do I do with these outliers? Artificial intelligence can provide you the data, can show you the insights, but what does that actually mean? We're probably going to have to do a whole lot more clinical research, given now the variety, the velocity of data that's coming through, before we can transform it into how does that change the care that we get delivered, where we deliver. And that's really where the rubber hits the road, because ultimately, if we're using technology for technology's sake rather than to drive better outcomes or efficiencies, then we're not getting the best potential out of it.
Sorry, totally agree with that, but just quickly for me, just no one's touched on the kind of the 800-pound gorilla in the room, elephant in the room, privacy issues. Mm-hmm. So we have all this great wisdom technology on the same planet again. How do we deal with the privacy issue? Do we need the legislation? Do we need the governments involved? Yeah. How's it happen?
Let's tackle the privacy legislation. So I guess the first thing is we've talked a lot about ChatGPT, but ChatGPT is a consumer tool. Put your information in, data gets processed offshore, and how can you trust that? Increasingly, I think you're going to see organisations like Microsoft who already take the core of that language learning model and then wrap it in responsible AI principles so that you can use it on your sovereign data sets, will allow you to keep that information within your perimeter. But in general, we need to advance our privacy legislation. In Europe with GDPR, they're probably at the most progressive edge of what does privacy legislation look like. Here in Australia, we have the Australian Privacy Principles as an overarching entity, but we manage breaches by exception and precedent. So I think we need a grown-up approach to privacy in the digital age. We also need to acknowledge upfront the fact that there are bad actors out there. I mentioned the digitally advanced industries. The most digitally advanced industry is actually cybercrime, if you decide to recognise that as an industry. And out there on the dark web, you can buy health data today, and health data costs at least 27 times more than financial data alone. You can go buy credit details on the dark web, but if you go to buy medical records, it's far more expensive. Why? because not only does it contain financial data, it contains all the elements for identity impersonation, fraud and theft, which is really interesting. So I think regardless of where we are today, we need to take a proactive approach to privacy to make sure this really important data is held secure, because you've seen what it looks like when the bad actors get their hands on sensitive data. With some of the recent breaches that we've had in Australia, that impacts people's lives. I think it's a really good point. There's some really sensitive really basic ways that we can up-level our security, but privacy takes a policy-based approach that needs to be enforced through technology.
Your point about bad actors is actually a cautious point for us, that we need to look at, can that data be manipulated in any way? AI won't itself ever have a conscience. There's not an ethical or moral component to AI. AI is never going to say, don't share this information with me. That doesn't make sense. AI isn't going to actually say, this doesn't feel like the right thing to do. Or sometimes, giving the wrong information is kind. Those kind of ethical value sort of judgment things that you do see in some, very, very particular situations with, is this person medically competent? What's their family situation? How are you communicating all of this? Those are the things that we absolutely need our core humanity to drive. And we need to make sure that we've got safeguards, not just on the privacy, but also understanding the data that's feeding into that AI to ensure that it hasn't been manipulated in some way to have an economic impact, drive people to get unnecessary tests, et cetera.
So I was just going to answer that from a practical standpoint, I guess. I'm involved in building big data sets to build AI. And obviously, healthcare data is very sensitive, and so we take it very seriously. And the approach we've taken is we have zones of data. The most sensitive, like personal health information, is mainly US data. Basically, we don't touch for research. It sits there in on-site clinical record systems. If we want to make use of that data, we have a multi-stage de-identification process that complies with HIPAA legislation, which is the legislation that governs personal health data in the US. And we have an independent third-party expert come in and validate our de-identification procedures. It's called the expert determination procedure. And that basically ensures that our de-identification procedures make it virtually impossible to re-identify an individual. And so the bigger the data sets, the more de-identified they become. And so the ones we use to train AI and the ones that we have access to internally are totally de-identified. The dates are all shifted, the ages are capped, the number of births people have is capped, so it's virtually impossible to identify anyone. But what that allows is for people to use that data and innovate in a way that's safe. And it's much the same way that a company like Google, very few people will be able to access the real email address. You have some identifier, but it's not the real one. So that's how we kind of enable innovation while minimizing risk.
It's funny, you took the words right out of my mouth, because I was sitting here thinking as you were talking earlier, the role of synthetic data and the importance that we have on the role of synthetic data within the development of AI in healthcare. There's not a day where I'm not talking with some of the data scientists about, okay, where's the synthetic data set that we're going to use for that development is here, and so on and so forth. So I think there's an increasing role of synthetic data because we recognize the challenges around the PHI, the personal information that we cannot use or share. It's just too risky to play with that data, so we don't. Yeah.
Just one other point. I think the flip side of privacy is consent, and we need an updated modern consent model. The prevailing consent model between a doctor and a patient is, I'm going to ask some sensitive questions. You answer truthfully on the basis that I will take that information and I will use it for your diagnostic and therapeutic process. And if I need to share it with anyone, they'll be involved in the small circle for your benefit. Nowhere do we ask the question of, hey, if I collect your information and then de-identify it, could we use it for the advancement of medical science? Could we do that? Because we don't ask that question, we aren't geared to do that. So it'd be nice if we upgrade the explicit consent with our patients so that we can bootstrap this AI revolution.
There was a program in the US just recently where they did that. I think they asked 1 million people to come forward and share their medical information so that they could run certain studies. So yeah, those sorts of things are happening overseas.
The other approach that we haven't taken, but some groups have, is called federated learning. And this is this idea that instead of having one big central AI that runs over all the data, you actually train multiple models at different hospitals, and then you combine the models after the fact. So the models you don't have to share the data or pool it, and so it's another way you can approach model training without letting that sensitive data leave its location.
Great. Okay, I'll just final check for any questions. We're coming to the end of our time frame for the presentation today. Looks like we're all good. Okay, well, thank you very much to our panellists. So Simon Kos, Teri Thomas, Lester Litchfield and Nick White. Could you please thank them in the usual way for their presentation today?